Breast reduction surgery is performed for patients with symptomatic large breasts. When patients come and see me to consult for breast reduction surgery, they generally report a classic constellation of symptoms. These include pain in the neck, back and shoulders, grooving in the line of the bra strap, rashes under the breast which can become red, painful or itchy, and difficulty finding clothes which fit appropriately. Patients who undergo breast reduction surgery are usually very satisfied. What we need to do is to address issues with the weight and heaviness of the breast, ptosis or drooping of the nipple, which can hang below the breast crease, and redundant skin as the envelope stretches to accommodate the larger breast. Surgically, what we're aiming to do is to reduce the volume of the breast, to give it a more youthful shape, and also to position the nipple and areola at a position which is considered more youthful or pleasing. Another factor which a lot of patients with large breasts complain or mention is a large or stretched areola, and this is reduced during breast reduction surgery as well. There are many techniques and styles of surgery for breast reduction. In general terms, the nipple and the areola are kept alive on a blood supply when they're moved. Gland is excised, and in some cases fat as well, and then the skin is reshaped around the breast. It really depends on your particular anatomy as to what scar pattern is used for a breast reduction, but the most common would be a scar around the areola and vertically down on the underside of the breast, which we call a lollipop scar. Scar around the nipple, a vertical scar down, and a lateral extension towards the armpit in the crease of the breast. We call this an L scar. Or in cases where there's a significant amount of skin which needs to be excised or the breast reduction is large, the scar will run around the nipple, vertically down the underside of the breast and then horizontally under the breast fold, and we call this an inverted T or anchor pattern scar. Breast reduction surgery always aims to achieve symmetry, but no two breasts are the same when we start. We call breasts sisters, not twins. And what we mean by that is that everyone's breasts are different in the size, the position of the nipple. And these factors impact on any surgical procedure of the breast and means that some degree of asymmetry is inevitable, but we obviously aim to minimise it. Some ancillary procedures we often perform in association with breast reduction are liposuction of fat pockets over the upper pole or top of the breast, and sometimes along the side wall of the chest as well. Breast reduction surgery is classically not a very painful operation, but it does require a night's stay in the hospital. We do this to ensure that the nipple areola complex remains healthy, and if there were any adverse events such as bleeding, these can be managed appropriately. Drains are often placed at the time of surgery during a breast reduction, and these are commonly removed the following morning before you're discharged home. Like all surgery, breast reduction has some risks. It's important to consider if it's appropriate for you. Ideally, breast should be fully developed. There should be no plan for rapid weight loss, and any pregnancy or breastfeeding should be completed prior to breast reduction surgery. About 6 months after breast reduction surgery, I like to do a mammogram to establish a new normal for your ongoing surveillance of the breast. There are a number of risks of breast surgery. The most common, as we've mentioned, would be bleeding, issues with the nerve or blood supply to the nipple areola, which can cause changes in sensation or partial or full necrosis or death of the nipple. This is very rare, but is something we always warn patients about. We send the tissue off for histological examination, and very rarely they find some cancerous cells in the breast tissue which are unexpected. Asymmetry is common, but this should be minor. There can be necrosis or death of fat within the breast tissue when it is rearranged, and this can present as a lump or a cyst in the breast. That being said, breast reduction surgery is a commonly performed procedure and has a low complication rate.